today we're going to talk about a really very sensitive topic for many men, but I think they're going to be so relieved to know what they can do about it, and that is male gynecomastia. So what is gynecomastia?
Well, Sheila, simply put, gynecomastia is unwanted excessive breast development in males.
And so why should a man treat gynecomastia?
That's a great question. So men, like women, always want to look their best. And excessive growth in a man's breast, or even an adolescent's breast, greatly affects their behavior. They change what they do. They don't take off their shirt in the locker room while playing exercise. They stop swimming. They do all sorts of things, and it affects their self-confidence, even their relationships with women. And that's what makes this surgery, correction of gynecomastia, such a wonderful procedure.
And that might be a lot like a female having a very flat chest and feeling that insecurity and not that confidence that they could have, which is why they have breast augmentations.
Exactly. I'll give you an example of a patient I just recently treated. This was a college football player, and a star college football player, but yet after the game he would never take off his jersey to shower with the rest of the guys. He would somehow slip out of the locker room, go home and shower, just because he was embarrassed. And shortly after the surgery, returning to practice 6 weeks later, it just changed his whole demeanor, his dating behavior, how he behaved. What a world of difference.
What maybe are some of the causes for gynecomastia?
Well, it turns out there's many causes, but the most common ones are a family trait. It's oftentimes inherited. It can be with excessive weight gain or loss. There's often endocrinological changes that also occur, and some occur naturally. When a man gets older, for example, there's less testosterone produced and so on. But most of these changes are ones that are easily and readily correctable with surgery.
So then, Dr. Nichter, are there different types of gynecomastia?
Great question. There's sort of two types of gynecomastia, although most fit somewhere in the middle. So one has excessive breast growth, and it's mostly soft tissue nature, more of a fat density. And in those cases, we use more of a liposuction technique to remove the excess.